If you're over 60 and your knees hurt when you stand up, walk, or climb stairs, this might surprise you. The problem may not actually be your knees. Most people think knee pain comes from aging, but in many cases, it's weak balance muscles and unstable legs putting extra pressure on the joints every single day. And here's the good news. You don't need expensive equipment, long workouts, or painful exercises to fix it. In fact, there's one simple balance exercise that seniors are now using to reduce knee pain, improve stability, and make their legs feel stronger again, all in just a few minutes a day. This gentle movement helps wake up the muscles that protect your knees, improves coordination, and lowers your risk of falls at the same time. Today I'll show you exactly how to do it safely at home, even if you feel unsteady or haven't exercised in years. Stay with me, because this small daily habit could completely change how your legs feel when you walk, stand, and move. As we grow older, many people begin to notice that simple movements don't feel as easy as they once did. Standing up from a chair takes more effort, walking for longer distances feels tiring, and climbing stairs may cause discomfort in the knees. Most seniors believe this happens only because of aging or joint damage, but the real reason is often muscle weakness and reduced balance. Your knees are not designed to work alone. They depend on the muscles around them, especially the thighs, hips, calves, and even the small muscles around the ankles. These muscles act like natural shock absorbers. When they are strong, they share the workload and protect the knee joint from pressure. But after the age of 60, muscle mass naturally decreases if it is not regularly used. This process causes instability in the legs. Another important change that happens with age is a decline in balance. The body's ability to sense position and movement becomes slower. Because of this, your body starts making tiny adjustments while you walk or stand. You may not notice these changes, but your knees feel the extra strain every day. When balance is weak, the knee joint often twists slightly or carries uneven weight. Over time, this repeated stress can lead to stiffness, soreness, or the feeling that your legs are not steady enough. Many people respond by moving less, but less movement actually weakens muscles even more, creating a cycle of discomfort. The solution is not intense exercise or painful workouts. Instead, gentle balance training helps wake up the stabilizing muscles that have become inactive. These exercises teach your body how to distribute weight properly again, allowing the knees to move more naturally. Improving balance also improves confidence. When you feel stable, you walk differently, smoother, safer, and with less tension. This reduces unnecessary pressure on the joints and helps daily activities feel easier again. The goal is simple. Rebuild coordination between muscles and joints so your legs work as one system. When balance improves, strength follows naturally, and many people begin to notice less knee discomfort and greater control in their movements. There is one simple exercise that many seniors overlook because it looks almost too easy to be effective. Yet this gentle movement activates some of the most important muscles responsible for protecting your knees. It is called the supported single leg stand, and it focuses on balance rather than force or speed. This exercise works because everyday walking is actually a series of single leg balance. Every time you take a step, one leg supports your entire body weight for a brief moment. If the muscles responsible for stability are weak, the knee absorbs extra pressure. Training balance helps prepare your body for these natural movements. To begin, stand near something stable like a chair, kitchen counter, or wall. Safety always comes first, so choose a support that makes you feel comfortable and secure. Stand tall with your feet hip width apart. Relax your shoulders and keep your gaze forward instead of looking down at your feet. Slowly shift your weight onto one leg. Take your time with this step. Feel your foot pressing into the ground as your muscles begin to engage. Then gently lift the opposite foot just a few inches off the floor. The lift does not need to be high. Even a small movement activates important stabilizing muscles. As you hold this position, you may notice small movements in your standing leg. That slight shaking is completely normal. It means your muscles are waking up and learning to stabilize your body again. Try to breathe normally and avoid tightening your upper body. At first, holding the position for 5 to 10 seconds is enough. Over time, your balance will improve, and you may comfortably reach 20 seconds or more. The key is consistency, not duration. This exercise strengthens the thighs, hips, calves, ankles, and core muscles at the same time. Because multiple muscle groups work together, the knee receives better support without excessive strain. Many seniors are surprised that such a gentle exercise can feel challenging. That challenge is exactly what helps rebuild stability. With regular practice, movements like walking, turning, and standing begin to feel smoother and more controlled. Doing this exercise correctly is more important than doing it for a long time. Slow, controlled movement allows your muscles and nervous system to communicate effectively, which is the true purpose of balance training. Start by positioning yourself behind a sturdy chair or beside a wall. Place one hand lightly on the support. The hand is there only for safety, not to hold your full weight. Stand upright with your head aligned over your shoulders and your shoulders over your hips. Before lifting your foot, gently tighten your stomach muscles as if preparing to stand taller. This small adjustment helps stabilize your core and reduces pressure on the knees. Now slowly shift your weight onto one leg. Avoid rushing this step. Feel your body settle into the standing leg. Lift the opposite foot slowly off the ground. Keep your knees slightly bent rather than locked straight. A soft bend allows the muscles to stay active and protects the joint from strain. Try to keep your hips level and avoid leaning to one side. Hold the position while breathing calmly. Many people accidentally hold their breath, which creates tension and makes balancing harder. Smooth breathing helps your body stay relaxed and steady. After holding for 10 to 20 seconds, gently lower your foot back down. Avoid dropping it quickly. Controlled lowering is part of the exercise and strengthens coordination. Switch sides and repeat the same steps. Aim for 3 to 5 repetitions on each leg. If balancing feels difficult at first, that is completely normal. Improvement often begins within a few days of regular practice. As your confidence grows, you may try reducing how much pressure you place on the chair, or briefly letting go for a second or two. Progress gradually and always prioritize safety. Remember, balance training is not about pushing through discomfort. It is about teaching your body stability through gentle repetition. Over time, these small controlled movements help your legs feel stronger and your knees more supported during everyday activities. Many seniors try balance exercises but do not experience the full benefits because of small mistakes that are easy to overlook. Fixing these habits can make the exercise far more effective, while also keeping it safe for daily practice. One common mistake is leaning too heavily on the chair or wall. While support is important for safety, placing too much weight on your hands prevents the leg muscles from doing their job. The goal is to use the support only as a backup, allowing your standing leg to carry most of your body weight. Another frequent mistake is locking the knee completely straight. When the knee locks, the joint absorbs pressure instead of the muscles. Keeping a slight bend activates the thighs and helps stabilize the joint naturally. This small adjustment makes a big difference in reducing strain. Many people also look down at their feet while balancing. Although this feels safer, it actually disrupts posture and balance signals. Keeping your eyes forward helps your body align properly and improves stability. Holding the breath is another habit that often goes unnoticed. When breathing stops, muscles tense and balance becomes harder to maintain. Slow, steady breathing keeps the body relaxed and improves coordination. Some seniors try to progress too quickly by lifting their leg higher or balancing for too long. Balance improves gradually, and pushing too hard can lead to frustration or discomfort. Short, consistent practice sessions are far more effective than occasional long ones. It is also important to practice on both legs equally. Many people naturally favor their stronger side, but training both sides helps prevent imbalance and reduces uneven stress on the knees. Finally, consistency matters more than perfection. Even practicing for a few minutes each day can create noticeable improvements over time. Balance training works quietly in the background, strengthening muscles and improving coordination without intense effort. By avoiding these simple mistakes, this gentle exercise becomes safer, more effective, and easier to maintain as a daily habit, helping your legs feel steadier and your knees more supported during everyday activities.